Cdha, your voice, your profession. Your voice since 1963, now 20,000 members strong. Your profession, sixth largest regulated health profession in Canada. During the fall 2019 federal election campaign, Cdha emphasized the importance of preventive oral care for overall health in all communications with candidates and the public. Following the election, Cdha identified potential oral health champions among new and returning members of Parliament who could be encouraged to keep oral health care on the national agenda. In February, Cdha board directors and senior staff spent the day on Parliament Hill, meeting with more than 30 members of Parliament and senators from all major parties. Together, they discussed critical issues affecting the oral health of Canadians and the dental hygiene profession, again emphasizing the importance of preventive oral care for people of all ages. In March, our lives were upended by the global pandemic. Businesses and schools were closed, staff were laid off, and we were all asked to self-isolate at home. Cdha refocused its efforts on ensuring that dental hygienists across the country would have the support required to manage professionally and personally during the crisis. Cdha sent urgent letters, met with elected officials and key staff, and collaborated with government agencies and other professional associations to champion the needs of dental hygienists and all healthcare professionals. In September, Cdha launched a campaign urging the Government of Ontario to approve a regulation permitting dental hygienists to treat their spouses. Dentists in Ontario had been granted that exemption in 2014, but dental hygienists, working alongside their dentist colleagues, were still restricted from providing oral care to spouses. Cdha members were eager to be a voice for change in Ontario. Their efforts drew the attention of elected officials and the public to this inequity. Cdha coordinated 7 rotations to fly-in communities in Nunavut, where dental hygienists provided oral care services to children ages 0 to 12. In August, Cdha met with the Chief Dental Officer of the United States, Dr. Timothy Ricks, and Canada's Chief Dental Officer, Dr. James Taylor, to discuss priority oral health issues for both countries. This was the first ever visit to Cdha by an American Chief Dental Officer. Also in August, Cdha represented Canadian dental hygienists in Brisbane, Australia, at the International Federation of Dental Hygienists House of Delegates meeting and related events. Together with their colleagues from around the world, our delegates Tracy Bowser and Beth Ryerse discussed ways to strengthen the profession and promote oral health on a global scale. Cdha conducts a job market and employment survey every 2 years. Last May and June, 5,347 members responded to the latest survey, providing rich data on employment trends and workplace issues affecting the profession. The main challenges faced by dental hygienists continue to be providing care to Canada's most vulnerable populations and utilizing their full scope of practice to meet the needs of their clients. Cdha sent weekly job posting updates to almost 7,400 members who subscribed to this service last year. Independently practicing dental hygienists provide services and improve access to oral care in remote and underserviced areas, for Indigenous peoples, as well as for seniors and other vulnerable populations. Cdha provided a strong, national voice for all independent practitioners in Canada. Meetings of CDHA's Education Advisory Committee, the Leadership Alliance, and the program directors of accredited dental hygiene programs kept the association up to date on pressing issues in dental hygiene education. In the early days of the pandemic, CDHA produced an information sheet on client screening and mask protocols for dental hygienists. Once dental offices were closed, CDHA was in constant contact with members by telephone and email, and began publishing regular e-bulletins and safety alerts on pandemic questions and concerns. The focus was on providing members with essential information on infection prevention and control, for those still working, federal income support programs, insurance coverage issues, and employment questions. After analyzing the data from its national survey on dental hygiene workplace issues, CDHA conceived and published a vision of a healthy and respectful workplace. Among its essential characteristics, a healthy and respectful workplace must be free from harassment, bullying, and violence. It must recognize the expertise of all team members, and it must be open, collaborative, and transparent in all interactions. CDHA also pledged to work collaboratively with key stakeholders to support the development, adoption, and maintenance of policies and procedures to promote healthy and respectful workplaces, and to develop tools and resources for members to support and reinforce a healthy and respectful workplace. Through media releases, print and television advertising, interviews and supplements, special events, social media connections, and our web presence, CDHA educates Canadians on the work of dental hygienists and the important links between oral and overall health. CDHA developed new messaging for its digital advertising campaigns following a survey of our public awareness network. While our television advertising buy on CTV, CBC, and Series Plus was postponed because of the COVID-19 pandemic, other efforts reached millions of Canadians. CDHA's social media presence remained incredibly strong, despite the fact that our Facebook business page was removed on March 17th without explanation. A temporary Facebook group was launched in April. CDHA's national public awareness campaign underwent an incredible transformation in a matter of weeks because of the COVID-19 pandemic. Unwilling to let self-isolation requirements ruin their celebrations, dental hygienists adjusted their education and outreach initiatives to fit a variety of virtual platforms. The dental hygiene community showed incredible resilience and professional pride as they shared information on oral health with the public in new and creative ways. There were thousands of posts, photos, and videos across social media platforms, and many landmarks were lit purple in celebration across the country. CDHA's Dental Hygiene Superhero Competition celebrates those dental hygienists who educate and empower their clients to embrace the Oral Health for Total Health motto. These clinicians are truly ambassadors of the profession who model exceptional client care. CDHA launched an online survey of 2,000 Canadians in January to gain a better understanding of public perceptions of dental hygienists and gaps in public knowledge. The survey showed that there is a solid foundation of trust in the role of the dental hygiene profession in healthcare. The association is committed to ensuring that dental hygienists are recognized by the public as partners in health promotion and disease prevention. CDHA's Image Bank continued to grow last year, offering members access to high-quality photographs that accurately portray the dental hygiene profession. A new diversity initiative will soon see photos of dental hygienists and clients of different ages and ethnicities added to the Image Bank. Cdha has a strong reputation as a source of credible, high-quality professional development offerings for dental hygienists. Last year, the association presented 8 webinars and 8 workshops on a variety of topics. In June, Cdha received a presidential citation from the American Dental Hygienists Association in recognition of the outstanding professional collaboration on the American Academy of Periodontology Dental Hygiene Symposium. To support dental hygienists in maintaining and improving their competence in coronavirus-related issues, Cdha enhanced access to free continuing quality improvement activities, adding over 25 hours of COVID-19 related learning to the online archive in March and April. St. John's, Newfoundland and Labrador was the perfect backdrop for Cdha's biennial national conference. Over 3 days in October, dental hygienists, industry representatives, and students were inspired by new knowledge on a wide range of oral health topics, experienced Atlantic hospitality, learned best practices, and networked with colleagues. The conference will be remembered not only for its high caliber of speakers, program quality, and networking opportunities, but also for St. John's generosity, kindness, and humor. The Canadian Journal of Dental Hygiene is Cdha's peer-reviewed research journal. In January 2020, the National Library of Medicine confirmed the important contributions of the journal to the global body of scientific knowledge by accepting it conditionally for inclusion in Medline, the world's premier online database of biomedical and life sciences literature. Oh Canada! Cdha's member magazine publishes information on clinically relevant dental hygiene and oral health topics, shares association and new product news, and highlights the innovative work of dental hygienists in Canada and abroad. The Canadian Foundation for Dental Hygiene Research and Education provides research grants to support Canadian dental hygienists in building the profession's body of knowledge and improving dental hygiene education and clinical practice to enhance the oral health and well-being of Canadians. Cdha released a position statement on vaping in February, replacing its earlier position statement on e-cigarettes. Cdha also published a position paper on the state of the evidence of a causal relationship between periodontal disease and cardiovascular diseases. Cdha celebrates exceptional volunteer service, research, and writing through our award programs, recognizing members who have made outstanding contributions to the dental hygiene profession. Junior and senior student representatives serve as liaisons between Cdha, students, and faculty. Cdha communicates regularly with our student representatives. We highlighted these incredible future dental hygienists in program videos and in O Canada magazine. This past year, 5 scholarships were awarded to registered dental hygienists enrolled in baccalaureate or master's level education programs. By offering premium member benefits, programs, and services, Cdha supports dental hygienists across Canada. Cdha's Partner Circle recognizes our dedicated industry partners who are strong supporters of the dental hygiene profession and who appreciate the central role that dental hygienists play on the oral health care team. Thank you to everyone who volunteered their time and expertise to the association, either as members of internal committees and working groups, or as representatives at the national and international levels. Together, we are CDHA Strong.